Hi, I'm Dr. Weng. So you're getting ready for your upper blepharoplasty surgery. Here's what you need to know. First, for about 4 weeks before surgery, you need to be nicotine free. No smoking, no patches, no vaping. And starting 2 weeks before surgery, you need to start avoiding any medications or supplements that can thin your blood. Typically, we will provide you a list of all of these, but they include things like fish oil, aspirin, and ibuprofen. On the day of surgery for your upper or lower blepharoplasty, a few important things to remember. Don't wear contacts, and don't wear any makeup, eye makeup, or false lashes. I would stick to a very simple skincare routine. Just use your cleanser and don't use any skincare treatments that day. And on the day of surgery, come into the office or surgery center in a button-up or zip-up shirt so that you don't have to pull a t-shirt over your head. That might mess up the stitches.
Hello, I'm Krista. I'm the surgical tech here at Dr. Pontel and Dr. Weng's office. I'm going to explain to you some post-op care for your blepharoplasty. So for the ice saline gauze, we want you to start that right away when you get home, and you're going to be doing it on and off as much as you can for the first 24 hours. So what you're going to do is you're going to take some gauze, and you want them thick, so a good like 4 gauze together. You're going to take some of your ice saline, you're going to let fall out so that you have some liquid in here. You'll pour it into a bowl or a basin, okay? And then you're going to take your gauze and you'll just dip them in the ice cold saline. Wring them out, but not all the way because you want some weight to the gauze. You'll fold them up and then you'll just gently place them over your eyes. You can either do 2 sets or you can make them long and do it all the way across. For the eye ointment, you'll grab your ointment and you'll open it, grab a Q-tip, put a little on the Q-tip. Be careful not to touch the tip to the Q-tip or directly onto your eye. Once the ointment's on the Q-tip, you'll then gently put it over your stitches, barely touching but enough to coat it both on each side. Okay. And then for your drops, you're going to just make sure that you shake them really well. Continuing with your post-op instructions, you're not going to be taking a shower. You're going to be lower body bathing, or you can use the handheld shower to bathe your body, but you're not going to be getting your face wet. You're also going to be expected to have swelling for 2 to 3 days. The worst part of the swelling, day 2 and 3, and then the swelling will slowly get better. You might notice some asymmetry in the bruising and swelling as well. That does not mean your results are going to be different on one side versus the other. That's completely normal.
After surgery, we like to check on you within the first few days to look for any swelling. Sometimes we recommend additional eye drops or creams with steroids to help the swelling. Usually at 7 to 10 days, all the stitches will be removed. By day 10, all the stitches are out and it is now safe to cover up any remaining bruising with any makeup. Some patients ask, when is it okay to use Botox around the time of surgery? I tell patients it's safe to use Botox up until the day of surgery and once the sutures are out. After surgery, for the first few weeks to months, there may be some slightly visible scarring along the suture line that will fade with time. And when you're fully healed, the scar will be imperceptible.